Uh, Dr. Berend, it's really special to have you here today to discuss patient lifestyle design and health because not only are you Chief Medical Development Officer and an orthopedic surgeon, but you compete in Ironman competitions. You're an avid cyclist. You're a sports fisherman. I mean, clearly you have a personal focus on this topic. So I think we're in for a good chat today.
Oh, well, thanks. Thanks for having me.
Yes. So uh, to get started here, give us a little background on why you wanted a virtual health coaching program for your patients.
Sure. So thanks for having me. That really is the big question in terms of the why, right? The purpose, the why. And we all know that obesity is an epidemic in our country.
Mhm.
Prediabetes is a significant problem because having diabetes means that you've had prediabetes, means that you've been on the course of getting diabetes for a long, long time before it's diagnosed, and then
Mhm.
it's treated. Same thing with obesity. We're not born obese. We gain weight and we gain it in the wrong ways over a period of time. It has to do a lot with lifestyle. And as an orthopedic surgeon, we know that many of the complications that we see, the risk is increased by obesity and by metabolic dysfunction. And so we have to do something. When I started in practice about 25 years ago, it was unusual to have obese patients. It was notable to say, oh, this patient's obese and we're going to do an operation. Now it's way more than half of the patients are obese with a BMI of over 30, or a huge proportion are morbidly obese with a BMI of over 35 and even upwards of 40 or 40 plus. So it's become a problem with trying to take care of people because more and more people are presenting with arthritis that has failed conservative treatment, and they need to manage not just their weight, but what's causing them to be overweight. And so, in trying to help manage these patients, it's difficult for a specialist to take the appropriate amount of time to help them. Because, in my opinion, this is not a diet strategy. This is even not with all the new drugs and the GLP-1s, and we can talk all about that, but that's not even a strategy for affecting lifestyle. And when we're talking about an operation that potentially should last the rest of your life,
Yeah.
changing your lifestyle in leading up to that or in recovering from that is probably way more important than weight in and of itself as a measurement. That whole thing requires so much lift, so much time, energy, and effort. It's really not something that an orthopedic surgeon has the time, the resources, or the energy to do, and we're not compensated for it appropriately,
Yeah.
and we're not experts in it. And so, as simple as saying, "Hey, go lose 40 pounds," that isn't the goal. And so when we started trying to manage this population of patients that's increasing, we were looking for a way to help do that. And it happens that enlisting the expertise with, in this case, Prescribe Fit, and also having a meaningful revenue stream from that is really a great combination for our practice, but most importantly for the patients. So all the way back to the beginning, we need to optimize the patients. It isn't just about weight loss, it's about lifestyle. And without putting all of this together in a sustainable way, meaning the practice isn't sustainable if you're spending all your resources and time doing this. And
Yeah.
so outsourcing it in a way that is meaningful is what really drew us to this idea and this concept.
Thank you, Dr. Berend. And so you touched on this a little bit, but to elaborate a bit more on that topic, um, how has integrating virtual lifestyle health coaching kind of maybe been a differentiator for your practice or felt like a unique advantage within your specialty?
Yeah, I think that it's super common to have patients come in and say, and I mean they're overweight. It's not a secret, right? I mean they're morbidly obese, let's say. And they come in and they say, well, I saw Dr. So-and-so over at such and such, and they said I needed to lose 100 pounds, 50 pounds, insert number. And they're left to do that. I mean, if they could lose that kind of weight, they would do it. And if they had good knees and good hips and good backs and good shoulders, they could probably have an easier time trying to lose weight. And it isn't about diet. It isn't about, trying to starve themselves, et cetera, calorie in, calorie out, et cetera. And so enlisting the expertise has allowed us to be a differentiator in our market, because we're not telling people, hey, you're too heavy, go lose weight. We're saying, hey, you're too heavy, but we have something that we can offer you alongside you to help you. We continue with conservative measurement and joint preservation with injections and therapies and all the things that we do as orthopedic surgeons. But what we're not good at is their lifestyle. And just telling them, hey, lose some weight doesn't get it done. And so we're the ones, as JIS Orthopedics and as Ortho Alliance and as the larger practice, we're the ones that are able to say to those patients, you found a home. Now, we don't want to say, oh yeah, we'll operate on anybody, because I don't think that's realistic or safe either. But I think offering them something that's meaningful and effective to benefit their lifestyle and lose weight and have better metabolic health and subsequently better mental health and all the things that go in with improving lifestyle, we're offering something that other practices in town aren't offering. And I think whether it's word on the street or whether we capture more people and they don't wander off because we just tell them to lose weight, I think it's great for the practice. Most importantly, it's great for the patients, but it's great for the practice as well.
Yes. I love how you said the word alongside, right? So kind of to build off of that insight, do you think, or how do you think that virtual care and lifestyle health coaching impacts trust, reputation, brand with, your patient community?
That's a really good question, because I think in today's environment, AI and virtual this and digital that and digital health and all this, this still boils down to, this is a people service. We're not plugging them into an app with some AI bot that's telling them, don't eat carbs. That we're partnering as a practice with someone that very professionally and very compassionately helps our patients that need help. And again, I think that it's no secret that if your BMI is 45, it's no secret that you're overweight. And what you probably don't need is, hey, you're overweight, go lose that weight, come back, and then I'll improve your quality of life. So partnering alongside someone that can have that compassionate message, lifestyle change, long-term benefits, not just the surgery, is super critical. And again, it's not something that we're experts at, and we didn't train on it. And I don't have the capability to have the kind of staff that can do that for the, oh, by the way, majority of patients that we see now are overweight.
Yes. Yes, it's really getting patients off of that vicious cycle of they know what they need, but how do they get it? They're in pain. And so, yeah, that makes a lot of sense. So shifting gears a little bit here, want to dive into the topic of virtual care models.
Mm-hmm.
So in what ways do you feel that embracing digital health solutions, for example, RPM, is a worthy innovation or a worthy priority within orthopedic care?
So it's interesting that you asked that. I've been tasked with giving a presentation at CCJR, Current Concepts in Joint Replacement, this Orlando, coming up in a couple of weeks, on the affirm side of, now's the time for RPM. It's safe and effective, and it's the data is massively meaningful, is basically the premise. My person I'm debating against is saying the opposite, that it's not meaningful, it's not helpful, it's not viable. There's too much data, too much information, security risks, all the things that we think about when we talk about digital health platforms and particularly remote patient monitoring. There, really, it boils down to three things, and that's accumulation of data, starting at the end, and what do you do with big data? And I think that us gaining as much information as we can is beneficial to the global world of healthcare. So, and how do you gain it? Well, you gain it with IT and tech that can gain it fast and accurately and passively throughout a patient's, day-to-day life, whatever. Nudging. So using your whatever communication you're using with the patient to nudge them, to feed them information for education, for it's time to do this, it's time to do that. And then what it actually does of monitoring, and that then boils down to what device are you using? Is it a step count? Is it something more advanced? Is it a digital scale? So in general, those are the three things that remote patient monitoring does. How do we use it to affect what we want to do with virtual lifestyle design and coaching and lifestyle health? Well, we use the tool to measure, but as I mentioned earlier, this is also a very uh, manpower intense process where you're measuring something, you're affecting care through that measurement that's done remotely, you're billing and collecting for that, and you're billing and collecting for the services that go along with the management of whatever condition you're trying to manage remotely. So long answer, data collection and analysis, nudging, education, information, et cetera, and the monitoring that goes into using RPM.
Thank you. And so this, to kind of further explore that, this next question again, you've kind of touched on it, but talking about a virtual care model, how has it served as an extension of your practice? You mentioned education and nudging. Do you feel more connected to your patients? Is there anything else you would dive into when we're talking about virtual care as an extension of the traditional care model?
Yeah, and that boils down to, again, not to let all the cats out of the bags of what I'm going to be talking about in
Yeah.
a couple of weeks at CCJR, but it gets into a couple of issues, and one is who's doing it, and do you have the manpower in a small practice to afford to give it the appropriate time? Do you have the expertise? Can you afford the expertise based on the compensation that you get from the RPM or from the therapeutics? And I think most folks aren't able to accomplish that. And so it becomes a burden to try to manage all of that information, all of that communication, the nudging, the monitoring, the alerts. Mrs. Jones, in this case, gained weight, didn't lose weight. She didn't check in, that's all valuable information, and it's powerful information to affect change. Who's doing it? And so the real beauty of this model, in my opinion, is I'm not paying my staff to do this. Prescribe Fit, or insert name of another model, but in this case, the one that has really worked well for the goal of wellness and lifestyle is Prescribe Fit, is doing that work. I'm managing it. I'm getting the updates. I'm kind of the kingmaker of the chessboard, as it were, but the work's being done to benefit my patients on my behalf, under my direction, with a partner that is Prescribe Fit. And my experience with it has been the entire way along, the patient knows that I've cared enough to prescribe Fit, that I haven't just told them go lose weight or go whatever. And their experience with the entire process is a positive one, where they're getting the feedback, they're getting the personal touch, even though it's digital, even though it's remote, that I can't afford time, energy, and finance to provide in my practice.
Thank you for the insight. Thank you for the glimpse into your CCJR presentation.
Yeah, don't want to let it all out because it's gonna be a good one.
Okay, we won't. So, last question, and then we want to leave some time for our attendees to be able to ask some questions as well. But what would you share with practices who may think to themselves, this is going to be too big of a lift to implement? Are my patients even going to engage and do this? What would you say to them?
I think that if you've been in practice for even a few years, you've seen this significant increase in the percentage of patients that are overweight, obese, metabolic disorder, insulin resistance, et cetera. And we all know every paper, those are risk factors for complications. We all want to be surgeons, we all want to operate, and we want to have good outcomes. Without trying to do something, this wave is coming, if it's not already here, in terms of obesity and metabolic disease. I think that this is the only real way to do it. Number one, from a compliance standpoint, understanding what you're supposed to do and what you're not supposed to do. Understanding it from a billing and collecting standpoint. Again, I think that it's one thing to say, oh, there's all these codes, and if you bill this, if you click this box, it's great. Well, it's great until it's not. And having an expert partner that can help navigate that without a huge lift on the part of the practice is really, really important, in my opinion. Because again, anybody can do this. I mean, you can give out scales and you can give out watches and whatever you want to do. No problem. There's tons of platforms that you can monitor, and then you can bill for it, and then you can document it. That's a huge lift for what ends up being a pretty small margin versus the time, effort, energy lift, as you said, of getting this done and getting it done to the benefit of the patients. And so having a partner like Prescribe Fit that knows what they're doing, that does it for a living, that can help with all of the things that create the lift, makes it a much easier lift.
Thank you. Thank you for that. Okay, so now I think we're going to turn it over to our audience for any questions you may have for Dr. Berend. Ryan, I'll turn it over to you since I believe you can see.
Yep. Yeah, so feel free to type your questions. Probably easiest to use the Q&A functionality in Zoom if you've got any questions for Dr. Berend or Amanda. We got one in there already about the recording, and yes, we are recording this, and we will send it out probably in a few days, maybe early next week, if you missed something or want to review it. It looks like we've got a few other ones popping in. This, I think, is for Dr. Berend. Question is, how did you get buy-in from your team, staff, other providers to do something like this?
Well, that goes a little bit to the lift question. And on the front end or the back end or whatever end that is, it goes a little bit to the lift question because you're not asking them to do a whole lot of extra work. You're prescribing it, you're putting them into the program, and it sort of starts rolling from there. And so there's not an enormous lift for that. I think a little bit of what we had talked about earlier, it doesn't take a ton of buy-in if your team understands the purpose of why we're here. And I don't mean here on the webinar. I mean, why are we here? Like, what are we doing? Well, we're trying to help people, whatever definition you want to use for that. In orthopedics, we're alleviating pain and we're improving quality of life. This is part of that. And if you've never done it, it's not comfortable to be a team member sitting in a room and having a surgeon say, Mrs. Smith, you're too fat. You can't have surgery. Now go lose 50 pounds and then leave the room. That if you're a team member, that's uncomfortable. Having something to offer, that I think motivates the team. That they know that they're helping somebody. by enlisting them and enrolling them in a program that can help them. Leaving them with nothing, that's an uncomfortable place to be. So I don't think it's difficult buying at all, mostly because there's not a lot of left, but also you're fulfilling the purpose of doing orthopedics and of having a practice.
Awesome. I think a related question is, how important is the patient education piece of this?
So it depends on where you're, at what touch point you mean. I think the entire process is patient education. The RPM is how we speak a language of monitoring and of managing, and how we bill and collect for these services. The education, that's all we're talking about. I mean, we're not cooking their meals for them. We're not helping them, change their lifestyle by being in their homes and, taking away the cookies and giving them almonds. So it's all education. If you mean from a practice standpoint, it's super simple. Patients know they're overweight. That's not a secret. Hey, look, we want to help you. We want to help alleviate your pain. We want to help improve your quality of life. We need to improve your lifestyle. I'm going to have these folks reach out to you. We're going to prescribe fit. And that's about the level of education that we give.
Yeah, I think another question just came in, and they just want to know what's the feedback been from patients? What have you heard from patients?
The feedback is, well, like anything else, the feedback is absolutely incredible for the patients that get engaged, that have success, that end up, saying, I've lost, and we've had patients, multiple patients, and that's not an exaggeration, lose over 100 pounds. We've had, I think since we started the program, our patients as a whole have lost more than 10,000 pounds, 5 tons, right? So like it is effective, and patients, especially those ones that are left out in the cold, they like this. And they appreciate the fact that you're acknowledging that they need help and you found them a way to do it, especially nowadays where, more than half the patients are overweight. About a third of them are on some kind of GLP-1. The other 2/3, it's not covered by insurance and they can't afford it out of pocket. So you've got this, and all of those patients would benefit from lifestyle coaching, right? And from lifestyle change. So it's been universally well accepted by the patients that get engaged. There are patients that don't get engaged, just like everything else that we do. And again, we're not showing up at their doorstep and making them do it. And so obviously they're not as satisfied with the platform, but the results have been amazing.
I think we have another question related to the logistics of all this. So do you prescribe this before the surgical event, after? Is it for non-surgical treatment? How do you do it?
All of the above. All of the above. So again, I think it's where you're seeing the patient in their journey. I just do hip and knee replacements. And so it's, are you coming in to have conservative treatment while you try to put off a joint replacement and you're overweight? Great time to get started with lifestyle change. You got all that time before you would need to have a knee replacement or a hip replacement, or back surgery or shoulder or whatever. Post-op, we're seeing patients back that are, oh my God, my pain's gone, and they're overweight. And now the rate limiting step is their wellness, their lifestyle and their health. And we identify them as being someone that might benefit from this and prescribe it. Or, hey, look, we know that you're suffering. We're going to get you started in the program to help get you quickly optimized for surgery. And then our hope is that those patients would continue on the pathway and in the program for as long as they will continue to benefit from lifestyle.
Awesome. Thank you so much, Dr. Berend. I think that is all we have for the questions. We have a few minutes left, but we can give everybody back 5 minutes in their day. I think if you think of anything, don't hesitate to reach out. Many of you may already know Amanda, but there's her contact information, and we'd be happy to get back to you.
Thanks everyone for joining. It was such a pleasure. Special thanks to you, Dr. Berend. Just really enjoyed hearing your experience and your insight. And as Ryan said, we will send out the recording. And if you think of anything or have any other questions, please connect with us. So thank you all. Have a great day.
Thanks, you guys.
Thanks.